I'm Dr. Eric, the founder and clinic director here at Synergy Oviedo Chiropractic. I wanted to talk to you today about a cutting-edge therapy for one of the most debilitating issues that we see in practice today, which is pain associated from a disc herniation. Now, oftentimes symptoms of that could be a pain down your leg, numbness, tingling, weakness, pain. It can also be the same symptoms in your arms or in your hands. It could even be headaches. It could also just be very strong debilitating neck pain, mid-back pain, and lower back pain. It could be pain when you cough or sneeze and you tend to notice pain. It could be pain where you notice that you're walking crooked. That sort of an issue when you first get up in the morning. It could be problems when you get up from a sitting position. So all those are signs of a potential disc herniation. Now, what can you do about that? There's a few therapies that exist in the medical community. One of them is epidural steroid injections. And steroid injections are helpful, but they are designed to just reduce the inflammation. But there's a lot of side effects anytime that you're using steroids. In fact, that's the reason why they only say that you can have a limited number, like 3 oftentimes, in an entire 12-month cycle. The other system or approach is surgery. And we all can agree that if you can avoid surgery, particularly back or neck surgery, by doing a conservative method, then that is a really good approach to do. In our practice, we have over a 90% success rate with people avoiding both of those types of things, having to have epidural steroid injections or having to have surgery. So although they might be necessary, we can really mitigate those aspects as well. In fact, we work a lot with orthopedic surgeons in our area and neurosurgeons as well. So what do we do in the practice to be able to solve this? Well, it requires what we call a synergy approach. And synergy means combining multiple healing arts working together to produce a greater result than by themselves. And when you're dealing with a disc problem, you're dealing with a very complicated issue that takes a more comprehensive approach to handle. So how do we do that? The first key is we have to take pressure off of the disc itself. Now, the technology that we use in our practice, which has been used with thousands of patients, is something called spinal decompression therapy. Now, what that is it's a traction-based procedure that does 3 major things. Let me show you. Now, normal anatomy is you have a bone, and you have a disc. And normally that disc is well maintained and the nerve coming out of that hole has no pressure. This is how it's supposed to be. Now, what occurs through different traumas, either from a car accident, sports injuries, or just repetitive issues over time, we can start to get tearing in these discs. These discs can get tearing in them, and it looks something like this illustration here. This is a central disc herniation, but it can also and oftentimes go out to the side. The problem with it going out to the side is the nerve that's being irritated and causing all those issues is being compressed and being pinched. So the first thing that decompression does in this traction-based procedure is it pulls. As it pulls, it makes the hole bigger and frees the trapped nerve, because essentially now you have a material, this disc, crushing the nerve, taking up space there, so that the decompression makes that space bigger. The second thing that decompression does is that it causes what's called a negative effect to the disc, or also called a vacuum phenomenon. So again, normally the disc is maintained, but what can occur is that you can get it where the disc comes out like that. That is a herniation right here. Well, when you do decompression, it pulls. As it pulls, it helps to bring that herniation back to where it's supposed to be. So it causes a vacuum effect, bringing it back in. The third thing decompression does is your discs have a poor blood supply. So what decompression does, it does a pumping motion, and that pumping motion helps to bring nutrients in and out of the disc, essentially flushes that disc with good nutrition to help to revitalize it. So again, the recap, decompression does three things. It makes the hole bigger, frees the trapped nerve. It causes a negative pressure to bring that disc back in. And then it does a specific pumping motion, which helps to renourish and rehydrate the disc. Now that's how you solve the disc issue. The next thing you got to worry about is, how did the disc herniate? Well, that's oftentimes a biomechanical or alignment issue. And that's where a trained chiropractor is involved in making sure that your alignment is good, because if your alignment is off, it's going to cause abnormal stress. So getting the alignment is going to be key, because if we just treat the disc, then it's just like treating a symptom of an underlying cause of biomechanics. So we have to correct the biomechanics. Then the third step involved is, again, decompression for disc, chiropractic for the biomechanics and the nerve supply. The third step is having physical therapy where we can strengthen and stabilize that tissue as well. That is going to be the key. So if we only do one step, say you just get chiropractic adjustments, although very powerful and very successful in a wide variety of conditions, but disc herniations are a more complicated situation. In my professional opinion, and doing this for 20 years, you have to combine it with decompression and combine it with a physical therapy's activities to be able to strengthen and stabilize that tissue. Those are the major things to do to handle a disc problem. If those don't work, and you do that for probably a 2 to 3 month process, then the next step might be to go towards the epidurals, or the next step might be to, unfortunately, you have to look at surgery. But what I would want to know, and what I tell my patients every day, is that if I'm going to walk into a surgeon's office and have that procedure, then I want to know that I did everything possible to correct my problem before having to do that. I want to be aggressive with conservative care and then get more aggressive, and that's what I recommend for you as well. So I hope this video was helpful, because this is a really big thing. I know that when you have a disc problem, and I know that when you have this pain or this numbness and tingling, it's scary, it's painful, it robs you of the experience of life, and we want to be able to make sure that we're correcting the root of it. Thank you.